So opportunities that I've had to demonstrate some beginning leadership skills in nursing has been when I've been assigned as student charge for the day. I've done it in two different clinical settings, and in the med surge setting, I started off the day by looking at my nurses. So you get to know obviously your fellow students, and so some of them, like one of them was a CNA who had been working at the hospital for a hot minute, and she was bored with some of her patient assignments. She told me that she very often were assigned walkie-talkies, as they called them, and she was ready for something a little bit more challenging. So I kind of kept that bit of information in my head as I was laying out the patient and student pairings. And I would look through the patients and see if they had anything that was going on, like their admitting diagnoses or any patient history that coincided with what we were learning in class or what we were about to be tested on in class. So for instance, if we're learning about diabetes and somebody has DK or got admitted with DKA, perfect. And so I would do that to make my pairings, to try to make it as beneficial as possible. I always feel like we learn it in class, but getting some hands-on opportunities would be really beneficial. After that, I would make sure that I went through all of the patient's active orders and ensured that those were being followed. So the student nurses would go off on their assignments, and I wanted to make sure that very often when I was assigned to a patient as a student, I would go through their active orders and see a lot of things that were not being followed. And so I wanted to make sure that I did that for all of the patients. So for the 4 or 5 other patients, I went through and made sure that they're active orders, and then I was just very easily able to communicate with those student nurses on being able to fulfill those active orders. And if there was something that they needed, whether it was like SCDs or something they needed for the patient, I would try to fill any gap that existed, whether they advocated, said, hey, I really need this help, I was happy to do it. But also if I saw some of those gaps already, like, hey, they've got a lot on their plate, they're really busy with this, they're gonna need this, let me just go ahead and do it. I also tried to use democratic leadership as much as possible. There are CNAs that had experience well beyond EMT, well beyond what I have. And so I was happy to get their input. We're all equals, we're all at the same level. And so I totally utilized their input and valued that as I kind of carried myself throughout the day. Another thing that I did that I felt was really important and demonstrated leadership was I went and checked in with each of those students regarding their patients. And I asked them if there was any big gap in that patient's care or anything going on with that patient that the care team should know. And I went in and I attended rounds. And so anything that was significant enough to bring up to the whole entire care team, I brought it up and advocated for that patient, whether it was something like the patient I talked about before. She didn't have a walker upon discharge at home that was safe to use. Anything like that. Oh, we had one patient on that specific day who had been admitted because she didn't feel safe at home. So she didn't have a lot of medical reason to be at the hospital. She just didn't feel safe at home. And so I made sure that was communicated there. So pretty much throughout the day, just making sure they had good pairings, making sure that they were supported, felt heard, and making sure that those patients had good, adequate patient care throughout the day, and that we were completing their care thoroughly. The end of the day, the only last thing that I did was I put a second pair of eyes on all of the charting that the students had done on each patient throughout the day, to make sure that they hadn't missed anything, that it was up to our current expectations, just to make sure that everything was done as completely as possible. In the ED, it was very similar, but I didn't get to do any pairings. It was kind of like talking to the students about which nurse they wanted to be paired with for the day, making sure those pairings got done, because there was maybe somebody in triage or somebody was in the higher acuity rooms. So just kind of making sure that they were happy with their assignment and supported throughout the day. Just kind of running around, making sure, if you need a flush, I'm here to give you a flush. Whether, small things. I didn't feel like those students were very competent, and I feel like they didn't need as much support as those in med-surg did, but still kind of tried to fulfill the same role where I was there and to support them as much as possible.